if I could begin with you, Andy, if you could tell us a little bit about neurotechnology and where you think we're at with neurotechnology and where we might be going.
Yeah, thanks, Alex, and I enjoyed the film immensely. I mean, I think the film is actually really quite timely, because I think where we're at with neurotechnology is really a tipping point or a transitional phase where a lot of these ideas are perhaps moving out of research labs and sort of proof of concept studies in academia, and moving quite rapidly towards technology companies and commercial interests. It's obviously very hard to predict how that transition will go. It's entirely possible that we're at the moment living through a sort of period of hype, which won't be realized. On the other hand, I mean, I think it's sort of fair to acknowledge that, you know, technology in a lot of fields is moving interest. So I think that now really is a good time to be thinking about, you know, where do we want these technologies to take us, and what do we want these you know, who do we want these technologies to work for? So, I mean, in terms of where we're at the moment, there has been an active research effort for probably the last several decades at least, to develop technologies that sort of sense brain activity, that manipulate brain activity, and to some extent can decode what's going on inside the brain, and send signals into the brain. Most of those technologies have been developed for medical applications, so attempts to sort of restore function after injury to the nervous system. And I think that for a while yet is going to be the major application of these technologies. But we are at a moment now where a number of groups are, you know, investing heavily in technologies for wider applications. So we see, you know, Facebook has a division that are developing brain-computer interfaces, non-invasive technologies, but allowing people to interact with Facebook without using keyboards. Obviously, Elon Musk has been getting a certain amount of attention recently with his Neuralink company, trying to develop interface technology, which he you know, is on record saying he hopes will kind of enhance our brain function and allow us to sort of link our minds with artificial intelligence. We can discuss if we want how feasible that is. But you know, as soon as we know that Silicon Valley operates on this sort of motto of moving fast and breaking things, and so it's very easy to think that this is all the realm of science fiction. But I do think that now is the time to be having these kind of discussions, before it's too late, before the technologies are out there, and we realize that you know, the society as a whole didn't have a say in actually sort of determining where we want to go with these technologies.
Thank you for that. Semande, so in terms of where we're at with how society views these things, obviously you're looking at things from the aspect of law and regulation and so on. How do you think, how safe are we? What do we need in place? What have we got in place currently that protects us in terms of these emerging technologies?
Okay, so I think that what I probably would do is to, I suppose, share some of the lessons that I've learned just from my work with, you know, prosthesis and, you know, other non-brain, you know, implants to date. And I suppose that one of the issues, especially in the past few years, that came up was with high-profile cases involving metal hip implants, you know, breast implants as well. So one of the issues that came out of that is that, you know, with emerging technologies, that it's very important that we have effective post-market surveillance, so of, you know, these devices. And also as well, that one of the things that we need to look at, I suppose, is the responsibilities of healthcare professionals in offering and monitoring, these implants as well. So in essence, I suppose it's important for us to monitor what happens. So after, the implant is, I suppose, left the market and, been integrated into, the patient's body, or even when, the implant is made available as well. So made available, for example, in the NHS. So simply because of, these high profile cases where, devices have failed and they've caused harm to patients, and you've had a lot of, litigation. So I suppose, post-market surveillance, post-market monitoring, it's quite, important, and was highlighted there as an issue that has to be considered with emerging technologies.
Yeah.
And another thing as well is from what I gather, I suppose that if I'm again looking at, the advances that have been made so far, so with, prosthesis and even things like ICDs, and pacemakers, for example. So a lot of these devices now have the capability to transmit, to gather data and to transmit data as well. And some of them actually have Wi-Fi capabilities, to enable them to do this as well. And of course, one of the issues that raises is the issue of, in essence, ownership of the data. So ownership and control of the data, because I can sort of understand that the healthcare authorities, the manufacturers might want to maintain, ownership and control over that data. But then there's, I suppose, a growing movement of patients now that actually, they're trying to get access, to the data collected from their devices, because they believe that the device belongs to them, and so that the data, belong to them as well. But then, because that's an area where law isn't very clear yet, because I suppose that law generally is usually tagging along, so and it's usually behind development in science.
Absolutely.
So, and these are, some of the issues that, I've raised as part of my research, that, with emerging, biotech advances, that these are discussions that, policymakers need to have in order to address some of these potential issues.
Absolutely.
And sorry, there was just one thing that I wanted to mention. I think you wanted to say something.
No problem. That's fine. I'll ask my question in a sec. Thanks.
Okay. And I suppose that another thing as well is, of course, if this data have, these capabilities, i.e. data collecting, data transmitting, Wi-Fi capabilities, some of the arguments that have actually been made is that that potentially makes them vulnerable to, third-party malicious hacking.
Yeah.
And with some of the devices that I've been working with, so you've actually had scientists that have demonstrated how easy it is to actually, hack some of these devices. So, and I think that another thing, and this is probably more of an ethical / psychology aspect, is that, so from one of my colleague, Jill Haddo's research, so one of the things that she's actually found is that patients actually find that some of these devices affect their personal identity. So, and that there's a disruption to who they are, once the device has been implanted into their bodies. So I suppose that we do need to try to find a way to gather, data about, patient lived experiences with these devices. And I suppose how patients, the psychological implications arising from, having these devices attached to their bodies.
Brilliant. I'm just going to stop you there, because you've brought up so many issues there. I think are absolutely relevant, and we do need to discuss. Andy, I just wonder, is it something that keeps you up at night in terms of what will happen with these technologies? Do you think that we are? I mean, obviously, I have an immense respect for people engaged in this kind of research, and I think they do ask those questions. But are those questions being asked at a wider level? Have you been asked about your work and the implications of your work?
So I think these conversations are starting to be had, and like I say, I think it's the right time for these conversations to be had. I think that, for instance, in the CANDO project, which is a project to develop a neural interface for epilepsy, we were really quite careful from sort of early on in the project to particularly engage with people suffering with epilepsy and their families, to find out more about how people felt about, you know, the use of neurotechnologies to treat disease. And I think that that's a very important part of the conversation. And there are, you know, again, good examples in the past of where scientists developing a kind of a fancy widget or a kind of a technology have actually, you know, failed to sort of necessarily address the needs of the user group. You know, a good example of that would be some of the controversies surrounding cochlear implants for the treatment of hearing, of deafness, where there was, I think, a lack of engagement with the idea that, you know, that to some people without hearing, that is not an abnormality that needs to be rectified, and that, you know, particularly sort of the use of you know, cochlear implants might impact on people's ability to kind of engage with a deaf community. I think in the case of epilepsy, I mean, it's a really interesting question. We asked this, and I'm sure Susan and Andrew, Susan Aldworth and Andrew Carney might want to comment on this as well, because as part of the exhibitions around CANDO, they spent a long time talking to people with epilepsy about, you know, the extent to which something like having suffering from seizures is a part of you, or is some sort of something from outside that comes in. But, you know, when we think about, say as scientists, we often say things like we want to restore normal function, but that is a very loaded term that comes along with, you know, what is normal function, what do we mean by that, and what are the things that we should be kind of aiming for with these kind of medical treatments, particularly as we move into perhaps more, you know, complex sort of psychological territory in terms of what are we aiming to correct, what is the abnormality, what is normal. So that was a long answer to your question, but I mean, I do think that it's something that scientists are increasingly becoming aware of, and it's very important that we have these discussions. I think just to end, I think the part that I'm kind of particularly enthusiastic about what we're doing here is, I think we need to also extend these conversations beyond just thinking about the needs of a specific kind of patient group, right? And I think it's important that actually, as a sort of society, we have a wider conversation about where we want these technologies to take us.
Yeah, absolutely. Yeah, thank you for that. Semande, I have a question. It was something that Patrick Degnar brought up earlier when he mentioned a series called Upload, and whether it was going to be possible in the future to upload a kind of digital version of yourself and so on. And I was wondering if legally, what do we consider the self? Would that include, if a person has a neural interface, if a person does take on some of this technology, is that included in the definition of self of an individual legally?
When you talk about the definition of self, so there isn't necessarily a legal definition of self, because I think that that's more of an ethical question of what actually encompasses, you know, self. So I don't know if you can clarify, clarify that question a bit.
Sure. Well, I'm thinking because neurotechnologies do sit right in what I consider the seat of self, which would be the brain. If a device is affecting that function, is the self altered in some way? And what if there were to be something which was not beneficial to that individual? Would that be considered an intrusion upon that person? Or yeah.
Okay, so I suppose that's actually one of the conceptual issues that I've raised, and that, you know, in my research with another colleague as well, that we've raised as well. Because at the moment, so the law generally maintains quite distinct boundaries. So between what is an object and, in essence, you know, what is, a person. So, and, so there's a distinction between, subject, object, person and things. And then the law maintains, separate rules, that apply to each of these. And I suppose that one of the issues with these sort of devices is that you're having integration of both, I suppose, the subject and the object, the person and the thing. So, and at the moment, it's not quite clear in law, whether, so for instance, so once the device become attached to the person, so does that then become part of the person, or does it actually retain its status as an object, as an object of property? So, and of course, that's an important question for law to address, simply because, if a device is integrated into a person's body, so let's say, for example, now the device is then, there's an intrusion. So there's an attempt, for example, to damage the device, there's a potential hacking incident. So if we, if the law treats it simply as an object of property, then the penalties and, the consequences of that are much more, are less, compared to, say, the penalties if you actually cause harm to the person.
Mm-hmm.
So I think at the moment, this integration of, subject and object creates issues that the law has not yet clarified. So, but of course, there are academics that argue that, because these devices, when you look at it from different angles, they do become part of the person, part of the living body.
Mm-hmm.
So, and that they should be treated as, so for example, if a damage is done to the device whilst it's attached to your body, then it should be treated as harm to the person,
Mm-hmm.
Simply because of the potential consequences. So if, because obviously if you damage the device, then you cause harm to the individual person.
Mm-hmm.
So, but I suppose the point is that there isn't really a clear, law hasn't yet had to confront that question yet.
Mm-hmm.
So, but it is definitely discussions that legal academics are having, or that we've started to have anyway, that law needs to provide clarity in relation to, so what is the status of the object once it becomes attached to the person?
Absolutely.
Because the status when it's outside the body is clear, but it's not quite clear what the status is when it's attached to the body. And the status once it leaves the body. So for example, if a device is then, taken out of the patient's body, again, it's still an object of property, but there's just not that clarity yet.
Andy, how do you feel about that? How do you see the neural interfaces that you're developing or hoping to develop in the future?
So I suppose I find the debate about it being inside, whether it's inside the body or outside of the body, to be a little bit of a red herring. I mean, I can see that the from sort of legal definition point of views, it might be quite useful to draw a dotted line around the body in terms of the skin. But I think when we're talking about kind of devices that say interact with the brain, I think we're talking much more about information being relayed from inside to outside. And I think it's probably less important as to whether or for a lot of the kind of ethical questions that I think about, it doesn't really matter whether that particular widget is under the skin or is sitting on top of the skin. I think what's interesting to me is where the differences are in the ethics of say neural interface technology versus the ethics of a lot of the existing technology that we already surround ourselves with. So for instance, when we're talking about kind of issues around data privacy, I think those are really real issues, right? And I think they're really important, but it's not clear to me that they're different issues to the issues of the amount of data that Facebook already collects on us, and maybe the neural interface discussion puts a lot of this kind of into focus. So for example, why is Facebook trying to develop a brain-computer interface? I would argue that they are trying to collect more data about you, and they're collecting more data about you because they want to be able to sell targeted advertising that's directed to you. And if they can record brain signals from you whilst you're looking at Facebook pages, that will give them additional information with which to work out what you like and what you dislike. And therefore that data is valuable to them. But whether that's going to ultimately be a different type of data than what you're doing in terms of mouse clicks and pointing at things, you know, it is arguable. But that would be an interface which is not implanted inside the body. I think the one that Facebook is developing is a sort of wearable headset. But I think that the questions of, you know, who owns the data, you know, who owns brain signals that were recorded from your brain, are really important questions. And you know, I think what neural interfaces probably does is it takes technology that one step closer to what we think of as kind of, you know, fundamentally our own, but actually, you know, maybe tech companies are gonna start questioning that.
Mm-hmm. Do you think we need, this is a question for both of you, do you think we need a Minister for Advanced Sciences and Technologies? I mean, somebody who is looking specifically at these emerging technologies and the implications, because data, as we've seen, you know, recently, when it's extracted and when it's manipulated, can cause a lot of problems. I know the university has been affected, lots of organizations have been affected by intrusions, and personal information, you know, extracted and so on. Do we need someone who's looking at this all of the time, who's kind of staying along the crest of the wave, rather than, as you mentioned earlier, Semande, kind of behind it? Should people be getting ahead of this?
I would say I think we do, because like I said, I think traditionally law tends to lag behind science, law tends to lag behind medicine. Mm-hmm. And I think that because these devices, simply because they are, you know, being integrated into the bodies. And by the way, these are not necessarily even just issues that, you know, affect emerging technologies. These are issues that actually affect, you know, technologies that we have at the moment. So, and that's why I did, you know, that's why I was part of the project, the Everyday Cyborgs, in essence, that, you know, so this is, you know, we're not necessarily talking about a future event. These are issues that actually affect current implants, you know, current devices, that law still has not addressed, you know, those issues. And it's simply because law maintains very clear boundaries. Mm-hmm. And we're having integration and, you know, blurred boundaries. And so it's, I suppose, important for law to be, you know, to begin to address, you know, the implications arising from the integration of these devices. Mm-hmm. So, you know, one issue that I haven't mentioned is to do with intellectual property rights. Yeah. So we, you know, generally law treats, you know, the property right in the tangible object, you know, separately from, you know, IP rights. So that's the reason why, for instance, you know, when you buy an item, so you might get, you know, the sort of tangible property right in the object, but you don't necessarily get a transfer of, you know, the intellectual property right. But then when you're talking of a device that is attached to the body, you know, there's a question there of, you know, ownership and, you know, control of, you know, the intellectual property right. So because then I suppose, is it ethically acceptable that under the current law, you know, you can have a device in your body that a third party has, you know, intellectual property right over it. Mm. Yeah. So, and that might not really seem like a big issue at the moment, but then when you think about, you know, some of the, you know, when you think about the movement, so the biohacking movement, so, you know, there are people that actually, you know, modify, you know, their devices. And also as well, I suppose that you have some of the consequences that flow from, you know, infringement of intellectual property rights. That wouldn't really, so like jailbreaking, for example, that wouldn't really be acceptable. So mm-hmm. if you try to, I suppose, block a device that is in somebody's body, but then it might be acceptable if you're doing it to a traditional computer, mm-hmm. as opposed to a device in a person's body. So I think that there's definitely, well, I would say that there's a need, simply because there are so many questions and so many issues that have been raised, mm-hmm. that we still do not know the answers to them yet.
Yeah, Andy, same question, I suppose.
So, I mean, I suppose I have slightly less faith. I mean, I don't want to get too political, but I mean, I have slightly less faith in the idea that a minister would be able to kind of get out in front of this. I mean, I think that there's a balance and a risk here, right? So there are risks of over-regulating. I mean, there is a risk of preventing, you know, very kind of useful and valuable technologies that could help people that you know that really, you know, need that help, by bad regulation. I think there's also a risk that the technologies will move so quickly that the regulation doesn't keep up. And I think particularly as a kind of, I suppose one of the things I worry about is the kind of Silicon Valley startup mentality coming into medicine more generally. So, you know, we could also discuss things like the Theranos scandal, where you know, again, a very fast-moving tech company did not kind of, you know, necessarily work to the same sort of standard. I think the ways that we need to approach this are probably to do with kind of really trying to set out the kind of culture that we want to work in. I think things like openness are going to be really important, and I think as technology development, particularly in this field, shifts from an academic environment where, you know, research is published and openly scrutinized, I think we really need to try and make sure as a whole, and, you know, maybe through regulation, but also maybe also through trying to sort of produce that culture that people will be open about their technology. And to give Elon his credit, I mean, thus far, you know, they have been quite open, say, what with the technologies they're developing. Not necessarily the same with some of the other companies in the field, but I think that's important. You know, regulation will play a role as well, but you know, and you know, going back to the vaccines thing, right? We're seeing at the moment the importance of the public being able to have trust and faith in the scientific process and the medical technology process, and it's really important that we retain this, I think.
Yeah, absolutely.
I would actually second that, because I think openness and transparency and public awareness, you know, regarding these devices, simply because I think that prosthesis, you know, so bionic arm, for example, bionic eye, so retinal implants, you know, I think people seem to be able to get their head around that. But then when you're talking of the brain, because of obviously the centrality of the brain to our lives. And one of the questions that I think someone posed when I think it was a session that I attended, so is that, and this was actually a question, because we were not actually discussing neural brain implants, but someone just mentioned about brain implants, is that, so for example, if you have a brain implant that has the potential to moderate or alter your state of mind, then the point then is that if you then go on to commit a crime, can you then blame your implant? So can you say that your implant, you know, made you do it? Or did you, you know, so I think these are things that we, you know, that are, I suppose, giving some people concerns, simply because of the centrality of the brain to what makes us human, I guess.
Yeah, absolutely. This is something that I wanted to touch upon with you, Andy, in terms of the science fact and the science fiction. I mean, it's alluded to quite gently in the film that the neural device that they've developed, which can process a lot of information and give a sort of diagnostic profile of an individual, a very accurate diagnostic profile. Is it conceivable that in the future this might be used for things such as enhancement? And enhancement we haven't really talked about too much in terms of brain function and so on. Do you have concerns there, or are there things that simply will not be able to happen?
So I think that in a lot of cases in the short term, I mean, I think enhancement is something that we probably we should worry about more in the context of, say, pharmaceuticals than brain implants just now. But I think it's a valid question. and I certainly think there are people work. So in terms of sort of what work is out there, there are, for example, some studies showing that, for instance, if you deliver electrical current to the right area of the brain, you might be able to improve your ability to do well in a maths test. But in terms of the actual sort of size of that effect, that's quite a lot lower than, say, the effects of things like ADHD drugs on academic performance. I think it's nevertheless it's clearly an area that people are interested in. I don't think the enhancement is going to be as straightforward as, you know, we're all going to get smarter, or we're all going to but I do think that, you know, increasingly the way we use technology is sort of changing the way we do things and facilitates the way we do things. And I think, you know, neural technology will be the next step in that direction. I do kind of hesitate with a lot of the more kind of slightly far out there claims as to what the kind of brain reading technology will be able to do. I think that kind of to some extent one could see it as a sort of rudimentary speech decoding. So it may be that in the future that instead of speaking to my Amazon Echo widget on my mantelpiece, I might be able to kind of concentrate and send that thought directly from my brain. But in terms of sort of reading, you know, deeper thoughts and memories, I think we're a long way from those kind of applications, just because we still understand so little about how some of the more complex cognitive functions go on in the brain. But, you know, I mean, it depends really what you mean by enhancement. But I certainly think that there are already out there companies that are attempting to develop neural interface technology to you know, ease and assist with some of the sort of day-to-day activities we might do in sort of interacting with a computer and so forth. Oops. I might have frozen. Yes,
sorry, I didn't quite catch you. You were saying that there are companies out there who are developing neurotechnologies that would, and that's when you froze, unfortunately.
Oh, sorry.
Sorry.
Right. So I mean, in terms of so there are I mean, so Facebook, for example, is a good example of a company that is attempting to develop a technology that would allow you to interact with Facebook pages without having to use your computer keyboard or your mouse. Now that could be described as an enhancement, but I think that I suppose and it may be that with sort of sufficient time and data, those applications that would get kind of up to, or maybe, you know, potentially even exceed our ability to interact with a computer using a keyboard and a mouse. When people talk, I mean, when we get onto kind of the kind of enhancement that I think Elon Musk is talking about, where he says he wants to connect our brains to artificial intelligence so that we can, you know, become, you know, qualitatively more intelligent, I think that's where I start treating some of that with a bit of a pinch of salt, because I think there's so much that we don't understand about how the brain works that it may be a while before we see those kind of things realized.
Yeah. So yes, so we're not looking at kind of super soldiers or anything like that in the near future. You know, people who can control drones with their, you know, target drones from the battlefield and that kind of thing.
No, but I think again, when you're talking about enhancement, I think there will be areas where we do see these technologies used with people with sort of scare quotes normal, healthy, functioning brains. So I mean, let me give you an example, because I also don't think all enhancement is bad. So for instance, I mean, a number of companies are working on headsets that long distance lorry drivers would be able to wear that would detect that the lorry driver is starting to get sleepy and should actually stop and go off the road and have a rest. Now that's an enhancement, because my brain doesn't always tell me accurately that I'm tired. and so that would be a neural technology for enhancement. But I think that's a perfectly, sensible thing. And as long as it's done, as long as we make sure that the lorry driver's brain data is being kept private, and all the other questions, I don't think that's a sort of fundamentally bad thing to be doing. And I think that's an entirely realistic technology, which I would say, be an enhancement. But again, it's different from the kind of science fiction idea that I'm going to link my brain into the machine learning, artificial intelligence.
Yeah.
Can I quickly pose a question to Andrew?
There was a question placed earlier, but
oh, can I? Is that okay?
go ahead.
Oh, okay.
Yes, please, please do. Yes,
I've heard
please do.
something, I suppose across the grapevine, but I haven't looked into it yet, so I'm not quite sure whether it's true or not, that you actually have neural implants now that that are currently being tested on patients with Parkinson's and depression. Are you aware of brain implants?
Yes, so so Parkinson's disease is one of the conditions which has really sort of, to some extent, led the way with brain implants being successful treatments. So deep brain stimulation, which is an electrode implanted in basal ganglia, sort of deep inside the brain, and an electrical stimuli is sent in from basically a thing like a heart pacemaker. That's a treatment that has enjoyed kind of considerable success in treating the symptoms of Parkinson's disease. It's not a cure. And I think there has been certainly over 100,000 people, I believe about 100,000 people have had this implant. And it's considered really quite a stand. One of our clinical colleagues could probably come in and correct me if I'm speaking out loud, but really quite a sort of standard frontline treatment for Parkinson's disease. And there is, certainly people are looking to extend the range of conditions for which deep brain stimulation is applicable. So there are people certainly investigating its application in depression, in epilepsy, in a number of other conditions. And the technology is getting more sophisticated all the time. But certainly with Parkinson's disease, it's actually quite an effective therapy.
Okay, thank you.
One of I believe your colleagues, Andy, was talking about regulation and the market, and pointed out that the costs involved in developing new technologies have increased exponentially, and so in effect the market has to be there, or you have to be able to gain investment from private institutions, companies, and so on, who themselves, I'm sure, will have their own vested interests. I mean, that's touched upon in the piece, because obviously Bella wants things to remain in the public domain, to be shared, for there to be openness, for everyone to have that availability to that technology. Can we divide market and purpose? Is it just something we have to face? We have to live with, I suppose.
I mean, I think it probably is something we have to live with. I don't have any great solution to that, but I do think that, for instance, I think there are areas where we can achieve more collectively working together, and that there can be win-win situations. So, I mean, for example, when you talk about kind of regulatory burden, I mean, I think there is a large regulatory burden, but I think probably most people would agree that there needs to be, a regulatory process before you can put something into the brain. On the other hand, there doesn't necessarily need to be as much, I would say, duplicated effort with regulatory processes. So again, this comes back to if we can share more and be more open about processes, data, evidence, then it may, facilitate more treatments coming to market by being able to sort of build off kind of common knowledge about what is safe and what's not safe. Now that, I think, I'm not an expert, but I think there's an argument for saying that could be built more into the regulatory process. But also I think that that's something that, you know, we as scientists and academics and can facilitate as well. So I think there are encouraging signs that people are willing to sort of share experience and build sort of centers of excellence where, you know how around what is safe, and so that you know, not everyone has to reinvent the wheel every time you come up with a new application for technology.
Absolutely. Semande, do you have any thoughts about that, about the market forces and how that might affect things?
I totally agree with Andrew. So because that's why you can see me nodding my head, because I think, because it's something that I looked at when I was looking at ownership and commercialization of bodily tissue. So in essence, when, you know, commercial products have been developed from, you know, bodily material. So, and the point is that I think that we do, you know, because we do need people to invest, we need companies to invest, and we need to facilitate an environment that enables or that motivates, or, you know, companies to do so. So I think that it is something that, as Andrew said, that we do need to live with. But I think that especially, so for instance now, so if the research is coming from, you know, the university, for example, so I think that there are, I suppose it goes down to negotiation. So I think that there are things that, you know, can be put in place, but at the same time, so we can encourage innovation, we can encourage investment, but at the same time ensure that it's done within an environment that also, you know, considers, you know, patients' need, that looks at, you know, safety. So I think it's just about more sort of integrated collaborative work between the relevant, you know, interested stakeholders.
Yeah, absolutely. I heard Matt Hancock say with great pride that the vaccine that was going to be delivered would be free at the point of distribution, and that it reflected all of the values of the NHS and so on, which is very good to hear. But then, for example, some of the tests that people are having to take before they can travel abroad, they're having to pay £99, for example, if they're flying to the Canary Islands and so on. With things as important as vaccines and this type of technology, should we be looking to always keep it as low cost as available? One of my concerns is about health inequality. You know, we do have in this region, significant health inequality, and that comes around for many reasons. But I just wonder if your feelings that these things will improve, or is it just inevitable? Is this something that's bound to happen? Andy, if I could start with you.
So, I mean, I think that's a, you know, bigger question than just neural interfaces. I mean, I think that it is very important that you know, there is equal access to these technologies. I think also when we talk about the applications for enhancement, I think it's sort of also important that there is sort of equal access to these kind of technologies. I mean, to some extent, these are expensive technologies, but I think also in terms of the kind of conditions that are being, you know, a lot of the conditions that are being targeted with particularly, say, invasive devices that you know, there's a fairly high bar to wanting to implant something in the nervous system. I mean, something like a, you know, spinal cord injury, which would render someone for many decades of their life perhaps unable to look after themselves and require kind of around-the-clock care. That is a very expensive process, and so, you know, in a lot of cases, the economics ought to be favorable towards a treatment which, whilst sort of somewhat expensive to implant and manage, ought to actually enable people to have a much more engaged place in society. So I think that you know, there's always going to be a question about, you know, the extent to which the NHS is supported and the extent to which it's able to distribute care. My hope would be that neural interfaces would overall be a kind of benefit to the care that the NHS deliver.
Absolutely. Semande, what are your thoughts then for the future? How do you think things are going to develop in that respect?
You know, as Andrew was speaking there, what was just coming to my mind was what the lecture that the pre-recorded lecture, so since we're all remote learning now, that I was delivering to my student, I think it was last week, yeah, I think it was last week, about the financial constraints on the NHS's budget. So, because unfortunately, we all know that the NHS is, has a limited budget and is facing increasing pressures, upon its current, upon its existing budget. So I know obviously as in at the moment, so where a treatment is not routinely available in the NHS, so the NHS has a, pocket of money that allows people to make individual funding requests, so that's why, for instance, cancer patients can get, experimental and expensive treatments that are not yet, on the NHS, that are available in other countries. So I think that I suppose there's capacity for the NHS, to fund expensive treatment for those people that need it. But it still does mean that, there are people that, need to access those treatments that are not able to, simply because of the funding constraints of the NHS. So for instance, people that are able to make individual funding requests, so they need to demonstrate that their clinical circumstances are exceptional. And obviously not all patients would meet, the strict criteria. So for exceptionality. So I think, health equality and equity of access is definitely an issue that we do need to look at as well. And I think that, we need to have a public debate about that issue.
Yeah.
But I do think it's important to recognise, and I don't have the figures to hand, but the cost to society of neurological illness and disease, things like stroke and looking after people after a stroke is a huge cost to society. And maybe we need to take a somewhat more holistic view of the funding of the NHS versus the funding of sort of social care and so forth.
Yeah.
But I think there is a real it shouldn't be the case that there's a sort of financial barrier to treatments for neurological disease, because it costs society so much. So whilst I understand what you're saying, I mean I think that we really ought to be effective treatments ought to be being able to be distributed.
Yeah. Absolutely. Yes, I agree. And there has been talk about integrating social care and healthcare and mental health and well-being and physical health and well-being. We're nowhere near that integration yet, but I think it has to come. And we do need a kind of visionary leaders in this respect. So my question to everyone is, what is the health research breakthrough you want to see in your lifetime? So if I could put that to both of you, whoever would like to, I know it's kind of off the cuff question, but I just wondered if you had any thoughts about that.
Funnily enough, I would actually say neural implants. So, simply because, I suppose because the brain is so central to the way that we do things. And I guess that my point goes towards the enhancement side of things to some extent. So I think that I will be quite interested in, so for example, in an implant that can improve my, memory. So, because I know that, we're still far off from that, because I saw an article where some people were talking about developing an artificial hippocampus. So, but I think for me, that would be, because memory is something that is just so important to me, especially as an academic as well. So although it's not really a health research breakthrough as such, but yeah, that's just my off the cuff comment anyway. So. Okay.
Andy, any thoughts about that device that might improve memory? You did touch upon, these enhancements and so on.
So there is quite a lot of work going on. I know the research Semande is referring to, I think, in the artificial hippocampus. I mean, it sounds slightly kind of futuristic, but I mean, they're actually slow and steady progress, but at this stage on relatively simple memories in sort of relatively simple experimental contexts. But we are understanding more and more about how memory works, and I think the idea that neural interface technology could play a role in perhaps sort of delaying the onset of dementia or things like this, I think that's entirely realistic. I think probably the idea of reading and writing and downloading individual memories is still in the realm of science fiction. But I think an implant that could modulate the circuitry to enable memories to be written, stored more efficiently and not lost. I think that's not necessarily science fiction. I mean, I think for my own, related to that, actually one of my own areas of interest, and I think is an area which I think is massively underexplored and underutilized. So I'm quite interested in sleep, and I'm particularly interested in thinking about ways that we can use probably non-invasive neural interface techniques, so not necessarily brain implants, but to improve the way we sleep. In part because we know that actually sleep is very important for storing and consolidating memories, and so I suppose my slightly sort of my answer to this question, just because it's something that I'm personally interested in, is thinking about ways of exploiting at least the 40% of our waking life where we're not, or our life where we're not actually awake and moving around, and thinking about whether we can use some of our knowledge of the brain to make better use of that time when we're lying in bed during the night.
Absolutely. And I have to say, during this period, my sleep patterns have been all over the place, and it's not, and I know that there are several friends who have had that same experience, and I know that there are reasons and there's a logic behind all of this, and that our lives have been disrupted in many ways, but I know that it has had an effect on my daily functioning and my resilience and so on. And I think that it would be great to know that there is a way that you can, possibly with less kind of drastic chemical intervention, get a really good night's sleep, consolidate all of those memories and brain functions that we want to look at. Yeah, absolutely.
I think that is, sorry, I think that's a very important point, because just from, cursory look at, research, dotted here and there. So I think especially I think as a nation, we do seem to have an issue with, not sleeping effectively, and like not very good sleep hygiene. So, but also as well, I think that especially with the recent onsets of COVID, I think that sleep has gotten worse for people generally. I think that definitely something to help us sleep more efficiently is much needed, actually.
Yeah. I know there's been and there has been a fair deal of research around how we interact with, I'll say, our devices, handheld devices, laptops and so on, when we're and again, as you touched upon, Semande, that sleep hygiene of making sure that we have some time away, is that something that we're just going to have to get on and do? We're going to have to be better at removing ourselves from this type of technology for a period before we sleep. Andy, what are your thoughts? Or are you guilty yourself of not fantastically good? I mean, I don't want to pry, but I mean,
I think it's something that people are becoming much more aware of. I think that the difficulty is that, unfortunately, if you are unfortunate enough to suffer from insomnia, the worst thing someone can do is to tell you all of the medical reasons why you should get better sleep, and tell you all the reasons why sleep is very important for the brain, because the end result is you just lie awake at night worrying even more about the fact that you're also harming your brain. So I don't know what sort of products today, but I mean, certainly, sleep is very important. I mean, it has been a strange period with the pandemic, and I think mental health in general is very important, and is going to be impacted by the pandemic. and there are strong links between mental health and sleep running in both directions. So I think it is probably something that we should all be aware of. Unfortunately, what works for one person doesn't always work for another person, and so it can be very hard to offer kind of useful concrete advice as to how to get a better night's sleep.
Absolutely. I'm just going to unmute Andrew Carney, who I'm just going to ask him to unmute. I think he has a question or he'd like to comment.
Yeah, can you hear me?
Yes.
Yes. Yeah, and I might disappear very quickly. I just realised my battery is about to go on my iPad. I have worked on a few projects, including the Can Do project, and for a very long time on a heart transplant project. I think the main issue for me that's come up is patient sensitivity and how we improve that. The psychological effects of all of these things are really quite tremendous, and that was the result that came through for me, talking to the Can Do patients and also talking to heart transplant patients. And I wonder how we can improve that, being sensitive to the psychology of people as they have these implants. It seems definitely to affect them in very strong ways. And it's true with the implants, from what I can see all the time. The sense that the person that came on a few minutes ago from the Health Council thing, I mean, the fact that he was disturbed by something, like it's almost like a voice in their heads. And even if it's not true, it's still affecting people psychologically. And I wonder how we can address that sensitivity.
Absolutely. I mean, I think it's an excellent provocation in a way, and it's something that we do need to consider. Andy, do you have any particular thoughts in that regard?
So I think that to some extent, probably part of it needs to be explaining the technology. I'm not sure necessarily that I think brain implant obviously comes with it a lot of kind of cultural associations of the kind of science fiction type of things. I mean, I'm not sure that a brain implant therapy necessarily needs to be thought of, or ought to be thought of differently to say taking a drug, which again, a drug will impact on your brain circuits and could have a very big impact on your sense of self. So I wonder whether at least part of it is the kind of cultural landscape that brain implants sit in. But I think whether it's a drug or it's a brain implant, I think probably it is important to try to make sure people are aware of what the thing is supposed to do, what the potential side effects are, and recognizing that any kind of treatment to the brain can have all sorts of impacts on things that we normally think of as under our own control and part of our self. These are technologies that are gonna impact on that. So that's not a very good answer. I think it's a very good question, and I'm sorry I don't have a better answer to it than that.
Just quickly,
Semande, yes, any thoughts?
Yeah, because I think that healthcare professionals, so the doctor-patient relationship for me comes to mind, and I think that healthcare professionals have a big role to play in that area. So in terms of how much information they actually communicate to patients before the devices are actually integrated into the patient's bodies. So I think that, from that, if you look at it from that way, I suppose that it's really no different, to any other treatment, so, but also as well, one thing that I would say as well is, I think that, follow up with patients is very important, because I think that is, as it is, the quality of follow-up is what would determine the quality of feedback, that we get from patients. So rather than just, as in we've given you this device, off you go, I think that there has to be like continuity. So where we're actually trying to find out from patients, how are you coping with the devices? Because as I mentioned earlier, so just to emphasize Andrew Carney's point, so patients are experiencing, so, in essence, issues with adjusting, to some of these devices. So I know, for example, with the ICDs, with the pacemakers, patients are experiencing issues with them. So patients, some patients are having issues with identity, that thing that I can, that I can see it and it's automated. I have no control over it. So I think that it goes to public awareness. It goes to, how much information is provided to patient. It goes to follow up as well. There's probably a lot to be said as well, for patient workshop. So because I know that there are some hospitals in London that actually do workshop, to educate patients before, they go through, surgery, or even, post-surgery as well. So maybe those are the things that we need to think about. But then I think that for me, what keeps coming to mind is, simply because it's something that I always talk about with my students, the NHS's budget, the NHS's budget. Mm-hmm. So I'm not quite sure how that's going to happen, but I think it's something that definitely needs to happen. Absolutely. But I think healthcare professionals, simply because of their relationship with patients, I think that they are very important. Yeah.
I just wondered, Andrew, in your work, when do you start to engage patients and these, and the people who might benefit from these technologies in those kinds of conversations? Or does that begin with clinicians and their relationship with patients and the research or anecdotal evidence that they have?
Well, so for the CANDO project specifically, I mean, we began engagement with patient groups from the very start. So actually, in terms of sort of developing a device, a treatment, I mean, we took the approach of writing down a set of specifications from the start, of which a large section of those specifications were user requirements, and we realized we couldn't write the user requirements ourselves, that we needed to actually get input from the people that would be potential users of the device. I think that this hasn't always been the case in the past with every project like this, but I think there is an increasing awareness of that. Now, I mean, that's you have to sort of scale this appropriately. So in our case, I mean, we are still some years from actually a device that we would implant in a person, and so these were initial discussions with a relatively small number of people. Obviously, as you move towards the starts of trials of a therapy, you probably need to expand that dialogue to sort of larger groups, and we've certainly had a lot of kind of support from epilepsy research charities to sort of help us kind of spread the word as to what we're doing. But yeah, I mean, I think that one of the motivations for us to sort of help with some of these sort of wider public engagement activities as part of the CANDO project was as a way of trying to sort of spread the discussion, be able to explain a little bit about the science, but also listen to what everyone's opinions were on this, and what people's thoughts were on the technology.
Absolutely, and certainly. So speaking on behalf of Operating Theatre, and I know from discussions that we had with Andrew Carney and Susan Aldworth, that those discussions with patients and patient groups were incredibly important. Because we were charged with reflecting as artists and as creative. We were charged with reflecting on the realities and the hopes and the development and the technologies themselves. And it's true that if you don't begin with those people, with the people who are living with epilepsy, who are experiencing that, if we don't understand their journey, their lived experience, then there's no way that we can reflect their needs, their requirements, and ultimately, I suppose, care for them and protect them going forward in terms of what the implications of that technology and so on. And I think there've been some excellent points raised about that the need for legal protections, some of the risks, some of the real possibilities for a shift in the conversation, and as John pointed out, the fact that you need involvement from lay people, you need involvement from patients and families and so on. Now, there is a question, a very specific question to from Rebecca Lee to Semande, and I sent it through to you, but I'm happy to read it out if you'd like.
Okay, I actually started typing the response to the question, but you can raise the question and then I'll respond to it.
Yeah, sure. Well, it's in the it was to everyone. It's a question for Dr. Semande. Do you think there should be a general law around the blame for crime, or is this something that should be subjective and evaluated on a case-by-case basis? And there's an example there. Should it always be evaluated on a case-by-case basis? But there can be an argument the patient gave informed consent to have this implant and understood the implications on their behavior before they had the procedure. So therefore, ultimately, they are still always to blame.
I think that's it's a very good question, but it's a difficult point to make. Because let's think about the law, for instance. So when, you have someone who is under the influence. So, if someone is, under the influence of drugs, for example, so the law doesn't treat them as harshly as it would, otherwise. So what I suppose that, the points, the correlation or the analogy that I'm trying to draw here is, yes, the patient, as in, the doctors might do their best to give the patient the information, but it's a separate question whether the patient really understands, the information provided to them. And also as well, I think that we need to bear in mind that with some of these, with implants, even with, pharmaceutical drugs as well. So it's very difficult for even medical professionals themselves to really, as in to fully understand, all the implications. And that's the reason why, for instance, you might have, sometimes where the GPs might actually ask you to report, so side effects, or even when you read, like the instructions. So on a pharmaceutical leaflet, for example, so it would say that, if you experience any other, side effects outside of these listed ones, then, tell your doctor about it. So I think the point is that if, medical professionals themselves do not really, understand the full implications of, the implants on a patient's behavior, then I think that it would be quite difficult to then have a general rule that just holds the patient to blame. But I think that, again, is that analogy again with, when, the fact that the law already recognizes that when you're under the influence of drugs, for example, so when you're under the influence of even pharmaceutical drugs, that you're not as, culpable, when you commit certain offenses. So, and I think that is directly relevant, to this area.
I'd just say that as operating theatre, we have worked with the Royal College of Surgeons in Edinburgh on a training program around informed consent. And what was clear is that although there were calls for particularly surgeons because of certain historical cases.
Montgomery, a very recent
Montgomery, case. Yes, absolutely. That there have been calls for many, many years for surgeons to engage in an open, frank discussion, to create, if you like, a contract between the patient and the clinicians, to be open and transparent and clear, and understand that they are creating a common endeavor, if you like, that the treatment is something that they agree upon, that all of the risks and so on have been pointed out. But the plain fact is that is not always the case, and there are reasons for this that we could go into, but I suspect this is for another time. But yeah, I think when it comes to something as crucial as your brain, as something that's inside your brain, that yes, all of these things will have to be discussed, which again takes me back to that thought that we do perhaps need a Minister for Advanced Science and Technology who at least creates a forum, who involves patients, who involves patients and carer groups and clinicians and researchers and politicians and economists and people who price medicines and so on. So we do need to create a different culture, and it's something you touched upon, Andy, in the sense that culture is important, and culture is all about behavior. And if our behaviors don't reflect the reality, then we're not doing our jobs, I suspect. Great. Now, I'm acutely aware that we have gone a little over time. I fully expected this. And I think unless there are any kind of burning questions that people would like to ask Andy or Semande before we go, I would personally like to thank Michael White, who has been our technical curator throughout. And I know there's a point where I received a message that said your internet connection is unstable, and that was probably people, I don't know, watching The Crown or whatever next door. But I do apologize if there have been any technical glitches that have interfered with your enjoyment of the discussion. But I'd like to thank, as I say, Michael, my colleague and friend Carol, who's been instrumental in the kind of research that created DeepMind, and also the project itself, which has allowed me to to discover a lot about what's happening now in this incredibly interesting technology. So thanks to you, Andy, and thanks to you, Semande, and thanks to everyone who's attended. The film is going to be available.
Thank
and
you
Andy,
for
I'm going.
inviting me as well.
Not at all,
yes,
not at all. Andy, sorry, you wanted to say.
A big thanks to you, Alex, for chairing this discussion, and also for the work on the play and your work with the Can Do project. And I'm particularly glad that we were able to have this screening after the disruption caused by to the live events. But I very much enjoyed the screening, and real credit to you for pushing through with this and managing to get this work out there. So thank you.
No, not at all. And I suppose I have to indirectly thank. Yes, you can. Absolutely. But it's been great to be able to do this, and we are happy to engage with other groups, at any kind of level, any self-constituted groups who have an interest in this. And this is an ongoing discussion. I'm sure that we will return with more discussions of this type. So thank you again. I'm going to hand you over to Michael just to sign off, if that's all right.
Yeah, I don't think much more to say. I don't know if it missed, but certainly I'd like to kind of thank you to the main public engagement grant was funded by Wellcome, but it was the Catherine Cookson Foundation at the university who kind of provided us with extra funds, which meant we were able to translate it into a film, and that the whole piece wasn't lost due to COVID. So we're very grateful to them. And personally, from my point of view, can I do Semande, Andy, Alex, Carol from Operating Theatre, and everybody who's joined us tonight and made this such an interesting evening. So thank you, everybody.
Thank you.
Thank you very much indeed. See you again.